Hi, I'm Jen Mattoni with the Suicide Prevention and Postvention Committee. Brandon is chief of the Suicide Prevention Branch at SAMHSA, where he also oversees the suicide prevention team. He also leads the Black Youth Suicide Prevention Initiative and is also the SAMHSA lead of SPRC, which is the nation's Technical Assistance Resource Center. And formerly, Brandon worked for the state of Maryland as the director of suicide and violence prevention. Workplace suicide prevention is a collaborative partnership between the American Foundation for Suicide Prevention and United Suicide Survivors International. It's built upon 8 guiding principles, which you can learn more about in some of our other videos, as well as learn about how these principles are implemented. The guidelines also include these 9 practices, which are organized into upstream, midstream, and downstream practices. And the goal really is to have leadership and professional organizations address suicide prevention and mental health in comprehensive, sustainable, and impactful ways.
Thank you so much for having me. I am incredibly excited to be here and to really share and talk about something that is in progress, something that we've spent a lot of time working on, and something that we are really excited to bring to the field. Just for folks who may not be as familiar with SAMHSA and the work that we do, this is a snapshot of all of the suicide prevention activities that we have going on at SAMHSA. So these are our grant programs. 988 actually does not sit in the suicide prevention office. It sits within the office of the assistant secretary, but that is our sister office. So we work and collaborate with them often. So we have our Garrett Lee Smith grant, state and tribal grantees, and our campus grantees that work to reduce suicide among our youth and young adults up to the age of 24. Zero Suicide, which works with healthcare systems. Our national strategy grant program that works with, on the community end, works with our adults and our older adults within community and does have a lot of workplace components there. Our Native Connections grant program that works particularly within tribal communities. And I already mentioned 988. Our community crisis response is our newest grant program. And that program enhances or creates mobile crisis teams within communities. So we're excited about that. And I mentioned the Suicide Prevention Resource Center. The National Action Alliance for Suicide Prevention is our public-private partnership to address suicide in the nation. And particularly we've had some work groups particularly focused on workplace suicide prevention. So excited to continue to work with them and to move this forward. And so today, what I wanted to talk about and spend some time getting into is particularly around our national strategy for suicide prevention. We are in the midst of working on developing a new national strategy for suicide prevention. So we are truly excited to advance and move that work forward. So I'll talk a little bit today about how we got the call to move this forward, how we are going about doing this and creating a new national strategy, some particular new components, some new topic areas that'll be a part of it, and talk about the release date. And there's also another project happening within the suicide prevention branch that I'll mention as well. Those of you on the call may be very familiar with our 2012 National Strategy for Suicide Prevention. It was released in 2012 as a collaboration really with the National Action Alliance for Suicide Prevention and the Office of the Surgeon General. And so for this one, we were directed, particularly from the White House, to update the National Strategy for Suicide Prevention with a release date of March 2024. And this is exciting for us because this is the only time we've really had such a strong backing for suicide prevention from the White House. So we are grateful to the Biden-Harris administration for the call and recognizing the importance of suicide prevention. With that, there came a charge. And the charge was to ensure that we're advancing the strategy to meet the needs of 2024. There were a couple particular places that we were charged to focus on and increase our information and goals and objectives on. And so a couple of those strategies were health equity. It says youth and social media, but it's really beyond that. So it's youth and technology. You know, if we think about what technology was when they started writing the strategy in 2010 is very different from where things are now. Social media is different now. Phones, apps have different capabilities that they didn't have before. And what does that mean for our young people as it pertains to their mental health and, their suicidal ideation or preventing suicidal ideation in our young people? The intersection of suicide and substance use is another one that we were charged to really pay some close attention to. And I'll talk about some other areas as well as we continue with this conversation. So interagency collaboration, this is an all of government project. Any federal agency that works in suicide prevention is at the table. There are so many agencies. I'm not going to go through the list of them all, but really it's a collective effort to advance suicide prevention, to develop this action plan. Our interagency working group consists of a number of agencies really to help advance and move this work forward in a consistent basis. So we meet consistently to talk through how we want to update this as well. And so on top of that, let's look at our leadership structure. We have our project management team, which is led by myself at SAMHSA, Dr. Dept at CDC, Dr. Richard McKeon, also at SAMHSA, Judy Qualters at CDC, Joel Dubinitz at ASPE, and Jane Pearson at NIMH. For those of you who've been around the field, a lot of those names may be familiar to you, and it's been truly an honor to move this work forward alongside them. Our endeavors are really being informed by our HHS's Behavioral Health Coordinating Council and the work that they've done already into addressing suicide prevention. And they've also been working towards some action items to address this. And one of the things I want to highlight and mention as well is that there's going to be a federal action plan attached to this national strategy. That has never happened before. So we have those different agencies at the table are developing action plan items to say, these are the things that we're committing to move this work forward. As we stand now, national strategy has 4 strategic directions that I'll walk through in a second. There are a number of new goals, so about 15 goals and 86 objectives. It sounds like a lot, but we really wanted to make sure that we were covering suicide prevention across the nation and ensure that we weren't having gaps there as well. The Domestic Policy Council has reviewed the goals and objectives, so they were approved and we're moving those forward. I'm going to give an overview of the goals. I can't go into the objectives because the entire document, because it's a federal document, has not been put forward for public release, and so we can't share the entire objective as well. We've done some work. We started really at one point we had 18 goals and over 100 objectives, and we've narrowed that down to what you see there. I'll talk to the strategic directions in a bit, but here's the breakdown that you can see there. SD1, upstream, we wanted to put a strong focus on this, and that there's also a new strategic direction on the intersection of health equity and suicide prevention. So we're excited to see that. If you look in the right-hand column of this where it says proposed new language, these 4 strategic directions are the strategic directions that will be a part of the new national strategy. So you see community-based suicide prevention, which focuses a lot on upstream, treatment as crisis services, that focuses a lot on our advancements in crisis services in 988, surveillance quality improvement in research, how do we improve our research efforts in suicide prevention, and health equity and suicide prevention, which is really new and exciting. Look into how we embed health equity across all we do in suicide prevention. So I'll give you an opportunity to see some of the goals that we have as a part of this. And so you can see the 7 goals for strategic direction 1. I'm really focusing on community-based suicide prevention, upstream suicide prevention infrastructure, and communication is really what you see here, and a commitment to addressing all of those topics within our strategic direction 1. So I'll give you a second to take that in. And lethal means, reducing access to lethal means, is also kind of throughout the document, but there's a large emphasis on it in strategic direction 1. Looking at SD2 and SD3, so looking at our crisis goals, really this is centered around how do we improve the overall crisis system. So not just 988, not just those services, but how do we improve overall and look overall in the advancing crisis services. SD3 really looks at how do we improve our surveillance systems and get more access to timely data. How are we making research more inclusive? How are we addressing research as a part of what we do. And workplace suicide prevention is mentioned a lot in the research space. So we can do more there and produce more around what specific activities can we do for workplace suicide prevention, what professions are impacted disproportionately for suicidal ideation and suicide attempts. We know historically where that's been, but there's been some shifts since COVID. So how do we make sure that we're addressing those pieces? And then our goal specifically on health equity and suicide prevention. So how do we ensure that health equity is integrated throughout the entire work that we're doing in suicide prevention? How are we ensuring that we're reaching and including voices of lived experience? How are we ensuring that we are bringing people to the table that have that lived experience or that represent historically marginalized communities, those disproportionately impacted by suicide? How do we ensure that there's voice there within the work that we're doing in suicide prevention? So that's a glimpse of the goals, and we're incredibly excited to move this forward. And I know that time is getting short, so I'll wrap this up. The other piece of this, I mentioned the action plan. And so we've charged every federal agency to develop some really impactful, high priority areas where they can move and advance this work forward. So we've asked that different agencies come up with at least 3 action plan items as a part of this. And so many agencies have done and have put forward well above that. So we are continuing to move that work forward, continuing to advance that work and gather up all the action items where agencies are talking to one another to see, hey, I saw you put this down. I would love to collaborate with you on this action plan item in this effort to really kind of build that strength. And then as we see gaps, we want to collaborate with the private sector and to be able to move a lot of that work forward collaboratively, collectively, and efficiently as a federal government. So we're looking forward to moving that together. And so with that, I will pause. I will wrap up. We're excited to have this released. We're looking to have this released in March 2024, hopefully with some fanfare. So we'll be able to really make an announcement on these. But we're truly excited to be working on this project. We really feel that this will advance and move the field forward, and we're looking forward to releasing this in March.
Thank you, Brandon, so much for that update. We'd now like to invite you to be part of the solution and to visit workplacesuicideprevention.com, where you can take the pledge to make suicide prevention a health and safety priority. Thank you so much for joining us.